Good morning, good afternoon, good evening, everyone. I know everybody is coming from different parts of the world, so welcome. I'd like to thank you for joining this session today, where we're going to present the 2024 Jenny Pomeroy Award for Excellence in Vision and Public Health. My name is Dr. Sandra Block, and I am currently the president of the World Council of Optometry, Professor Emeritus at the Illinois College of Optometry in Chicago, Illinois, and Board Emeritus at Prevent Blindness. And I have the honor of moderating this session. With that, I would like to go ahead and do the award presentation. The Jenny Pomeroy Award for Excellence in Vision and Public Health is named for Mrs. Jenny Pomeroy. She was an amazing woman and served as the Chief Executive Officer of Prevent Blindness Georgia from 1996 until we lost her in 2013. She was a champion for the role of public health in vision and eye health services and program. This annual award recognizes an individual, a team, or an organization that has made significant contributions to the advancement of public health as it's related to vision and eye health. The awardee is selected by a diverse group of volunteers, which include ophthalmologists, optometrists, and researchers who all have a public health focus. So now to the actual award presentation. The Mission for Vision was selected for this year's Jenny Pomeroy Award for Excellence in Vision and Public Health for its significant contributions to vision and public health research. The organization was founded in the year 2000. Mission for Vision seeks to restore the gift of vision to every visually impaired human being impacted, irrespective of their nationality, their religion, or their socioeconomic level. To date, Mission for Vision, or it's commonly referred to as MFV, has positively impacted the lives of more than 19.7 million people in India, including the enablement of more than 3 million eye surgeries. MFV works in 24 Indian states and union territories with leading eye health partners. Additionally, MFV has helped to establish and strengthen 24 secondary and tertiary eye hospitals that are ranking among the top in India, providing a model of sustainable social enterprise. MFV has also been training more than 700 allied ophthalmic personnel, particularly socioeconomically challenged young rural women, each of who are capable of serving at least 1,500 patients annually. This enables empowerment, augmenting service delivery and livelihoods. MFV has established 153 vision centers, including 5 mobile units, which enable primary eye care in remote geographic areas, serving more than 7.3 million people and working towards achieving self-sustenance in around 3 years. MFV has provided eye health services to over 830,000 children, including those with complex conditions such as retinopathy and prematurity and retinoblastoma. And MFV has also generated very valuable evidence on vision and public health, which is so important. So with that, I would like to welcome Ms. Elizabeth Kurian, the Chief Executive Officer for Mission for Vision, to accept the 2024 Jenny Pomeroy Award on behalf of her organization. She's now going to provide us with a presentation on how Mission for Vision has provided a quarter-century of person-centered eye care. As a quick reminder, you can submit your questions anytime during her presentation by putting them in the Q&A button found at the bottom of your screen. With that, I'd like to welcome Elizabeth.
Good afternoon, good evening, good morning, everyone. Thank you so much, Dr. Block, for that wonderful introduction. It is truly an honor to be moderated by you. Thank you so much. Ladies and gentlemen, my name is Elizabeth Kurian. I'm a brown woman from India with dark brown hair, and I'm sitting in a room with a white background that has the logo of my organization, Mission for Vision. At the outset, on behalf of the team, the board, partners and well-wishers of Vision for Vision, I would like to thank Jeff Todd and the board and management of Prevent Blindness for this immense honor of appreciating our organization with the 2024 Jenny Pomeroy Award for Excellence in Vision in Public Health. It's a privilege to have chosen among so many outstanding organizations. We are grateful. I would also like to convey our deep appreciation for Jenny Pomeroy's commitment to public eye health. My message today is around Vision for Vision's endeavors towards people-centered eye care and the prevention of needless blindness over the last quarter century. It also covers the situation globally, the various challenges, opportunities, and ideas for the way forward. In terms of the situation globally, according to the World Health Organization, at least 2.2 billion people live with a vision impairment, including visual impairment that has been addressed. And at least 1 billion of them live with vision impairment that could have been prevented or has yet to be addressed. Eye conditions are remarkably common, and those who live long enough will experience at least one eye issue during their lifetime. In terms of the context, the burden of eye conditions and vision impairment is not borne equally. 90% of vision loss is in low and middle income countries, impacting the poor the most. More than half of people with vision loss are women and girls at 55%. Around 3/4 of people with vision loss are older, over the age of 50. And in terms of lost productivity annually due to vision loss, it's a staggering US dollars 420 billion every year. Blindness is closely interlinked with poverty, and there's clear evidence that says that it disproportionately impacts indigenous people, rural communities, and migrant populations. In terms of the trends, experts say that the number of people with vision loss is growing staggeringly and alarmingly. And in the next 25 years, that is by the year 2050, we will have 1.7 million people who are visually impaired. But it's encouraging that at least 90% will have vision loss that can be prevented or treated due to conditions such as uncorrected refractive errors and cataract. And the rest of the 10% will have vision loss that are primarily that require management and treatment for more complex conditions such as glaucoma, age-related macular degeneration, and diabetic retinopathy. Eye health systems, services, and human resources continue to be challenged in the middle and low income settings. There are several challenges, as we are aware, as far as visual impairment is concerned. Visual impairment severely impacts learning and therefore educational achievement. It impacts negatively on workforce participation and livelihood. It limits mobility. There's evidence that says that women with vision loss experience higher rates of violence and abuse and neglect. All of this impact on the mental health of people and thereby the quality of life of communities. The key barriers to eye care remain the availability of services, accessibility, affordability, and acceptability. WHO endorses universal health coverage as key to mitigate these challenges. Universal health coverage means that all people have access to the health services they need when and where they need them without financial hardship. Affordable, accessible, and high-quality comprehensive eye health is essential to universal health coverage. In terms of comprehensiveness, that is what is key to enabling health systems towards universal health care. A comprehensive eye health system includes the full spectrum of essential quality health services, from health promotion to prevention, treatment, rehabilitation, and even palliative care. Comprehensive care also aims to address the full spectrum of eye diseases. In terms of the policy environment, there are excellent opportunities that we have ahead. And this has been great, especially during the last decade. And going forward, I'm confident that it will get even better. If you look at the Sustainable Development Goals, 8 of the 17 goals will need to achieve universal eye health in order for them to succeed. In 2020, the 73rd World Health Assembly endorsed a resolution on integrated people-centered eye care. The next year, the United Nations General Assembly adopted the first ever resolution on Vision for Everyone, accelerating action to achieve the Sustainable Development Goals. This was the first ever UN resolution. IAPB's 2030 Insight is the sector's strategic plan for the next decade, a call to action which outlines how we can end avoidable blindness. Several countries have also exhibited and demonstrated immense commitment to visual impairment and treating needless blindness, including the country that I reside in, India. Now, coming to India. India is a country that occupies a greater part of South Asia and is made up of 28 states and 8 union territories. India's government is a constitutional republic that represents a highly diverse population consisting of thousands of ethnic groups and hundreds of languages. As the world's most populous country, India's population at 1.3 billion is spread over an area of just 1.26 million square miles, and 34% of our population is urban. Our HDI, the Human Development Index, is growing and is currently at 134. Each state in India is required to provide free universal access to healthcare services. And as Indian citizens, all of us can access free outpatient and inpatient care at government facilities. This is because the Constitution of India obliges that the government has to ensure the right to health for all. Private voluntary insurance is also available. As far as visual impairment is concerned, India has a rich history of tackling blindness and visual impairment, including robust responses from the government and the civil society. We have multiple delivery models ranging from government-funded charitable and cross-subsidized eye care that have brought good quality care to our populations. India is also the first country in the world to have national commitment and financing for eye health with the establishment of the National Program for the Control of Blindness as early as 1976. We are also a signatory to the UN Convention on the Rights for Persons with Disabilities and have recently amended the Right of Persons with Disabilities Act in 2016. Coming to Mission for Vision, the organization that I work with, we've been working for several years. And that's largely because the population of India, in terms of visual impairment, is staggeringly high at around 56 million. If you include 8.8 million blind people and 47.7 people with moderate and severe visual impairment. If this population of 56 million were a country, it would be similar to the population of South Africa. Refractive error, uncorrected refractive error remains the most common cause of visual impairment under the age of 49, and cataract, the leading cause of blindness among those aged 50 and above. Last year, our country did around 9 million cataract surgeries, and we have a cataract surgical rate of around 6,500 per million population. We also see an increasing prevalence of other eye condition with the increase in the non-communicable diseases, and these include glaucoma and macular conditions, including diabetic retinopathy. We are also fortunate to see an increasing engagement of the private sector as far as blindness prevention efforts are concerned. We have increasing capability building in terms of innovation, technology, and most importantly, investment into the eradication of needless visual impairment and blindness from the private sector. Coming to Mission for Vision, my organization, we are basically a leading not-for-profit organization working since 2000 for the eradication of avoidable blindness. We endeavor to serve the most marginalized communities challenged by weak eye health systems in various parts of the country. And this includes urban areas, the urban slums, the remote rural areas, tribal communities, indigenous settlements, and others. Our endeavor is to cover people of all genders and of all age groups. We always aim to root our work in primary care and try and strive to be as people-centered as possible. We work in India and Nigeria and are founded by the Chandrai Summit Group, and probably are among the first examples of an NGO being set up by private philanthropy. We are guided by the vision and philosophy of our founder, Mr. J.M. Chandrai. In terms of presence, we work with 26 partners and 42 amazing eye hospitals in 190 districts of 22 states and 2 union territories of the country. Over the past quarter century, our services have enabled better care for over 19 million people, of which over 3 million have been cataract surgeries at no cost to the client. Around 50% of the people we serve have been women and girls, and that is extremely heartening. We are powered by a strong and passionate and diverse team cutting across various identities, comprising of domain and functional experts from the social sector, eye health sector, and the corporate arena, with a collective experience of over 700 years. So what do? We do various things. We have different programs and thematic areas. The first is establishing eye care facilities, primarily secondary and tertiary eye facilities in different parts of the country. We have helped establish around 23 eye hospitals, and each of these hospitals rank at the top in their respective geography. Each of them function as social enterprises, with 20 to 50% of the clients availing services at these facilities being charged, and the income from the fees is used to treat those who cannot afford to pay. All of these facilities are comprehensive, treat all the major eye conditions, and are also involved in training and research. Our programs are named in Sanskrit. Sanskrit is an ancient Indian language, and each of these names imply the impact of what we do in that particular area. The next program I'd like to share with you about is Mission Saksham. Mission Saksham is our endeavor to build the human resource workforce for our country. And this is largely for the training of allied ophthalmic personnel. Allied ophthalmic personnel are largely vision technicians, ophthalmic nurses, and ophthalmic assistants, among other groups that support optometrists and eye doctors in working more efficiently and effectively. It is very well known that 4 to 5 allied ophthalmic personnel supporting an optometrist or a doctor can optimize and enhance efficiency. This group is key to effective primary eye care. The training is for 2 years, and most of the trainees come from economically and socially challenged backgrounds. So we see a dual impact with this program. One is, of course, providing the much needed eye health workforce for the country. The second is the empowerment of rural youth, predominantly rural youth, especially women. Many of these young women come from very challenged backgrounds. India is a patriarchal society. Very often, families don't want their children, especially young girls, to leave their homes and travel to the big cities in search of a livelihood. But once these girls, and of course the young men, complete the training, they become highly skilled and very employable. Their confidence raises and they're able to earn. They often contribute back to the growth of their family, the education of the siblings. And when the young girls go back to the villages, they are seen as role models. So we are very, very pleased with this particular program because it is much more than beyond eye care. Cataract is a major cause of blindness everywhere, and Mission Netra addresses cataract blindness through high-quality surgeries. So far, we've enabled over 3 million eye surgeries at no cost to communities. And we know that free high-quality cataract surgery can increase household income manifold. In terms of visual outcomes post-cataract surgery, the surgeries that we've enabled, I'm happy to share with you that the outcomes we observe are compliant with WHO recommendations. 71% of the respondents were found to have visual acuity in the category defined as very good, and 20% as good, indicating alignment with WHO recommendations after cataract surgery. Before surgery, a staggering 99% had suboptimal or poor vision. Similarly, with quality of life, it's amazing to see the change in the quality of life and the confidence of communities once they undergo cataract surgery. The vast majority of the beneficiaries reported less difficulty in carrying out activities of daily living, economic activities, in aspects pertaining to mobility and psychosocial parameters after cataract surgery than before the intervention. For example, if you just look at mobility alone, before surgery, just around 9% said that they were comfortable being mobile within their homes and in the external environment. But after surgery, the number dramatically grew to 77%, saying that they had no difficulty in being mobile. So that is the impact of a cataract surgery. Mission Jyot is another thematic area, an area which is our flagship program. Mission Jyot is about establishing vision centers in remote parts of the country. Vision centers are primarily, facilities that are around 300 to 500 square feet, and they are manned by an optometrist or vision technician. and health workers trained from the local communities. Each of these centers serve a population of around 50,000, and they're able to do various things like education, counseling, refraction, dispensing of spectacles, identification of major eye conditions like cataract, retinal conditions, etc., and referral to the local eye hospital that they attach to. The post-operative follow-up is also done there. Each of these function as social enterprises because there's a small user fee, a modest user fee, and a small markup on the sale of spectacles that help these centers to sustain in around 3 years. Many of them, around 25 of the 161 centers that we've helped establish so far, have teleophthalmology, which enable communities to have live access to optometrists and doctors at the base hospital, and therefore real-time diagnosis and therapy, cutting unnecessary travel from the remote villages to the hospitals, which sometimes could take maybe even 3 hours, and also encouraging prompter action for more complicated and very challenging conditions pertaining to the retina. So these centers primarily provide access to communities in the remote areas, and they're very affordable and acceptable to the communities. During COVID, we saw very well that all the geographies that had these centers were able to provide eye health care to their communities because of the distance to the hospital. Very few could travel. There were transport disruptions. There were taboos in terms of accessing services, but facilities that had this were really very well served. Mission Disha is about providing good eye health care for communities at the workspace, particularly at-risk workers, heavy vehicle drivers, weavers, and other communities. ILO and IAPB have recognized that eye health significantly affects labor markets, and workers with visual impairment are 30% less likely to be employed. Vision impairment can reduce workplace productivity by 10% and accuracy by 40%. We have seen that 40% of heavy vehicle drivers that we provided interventions for have serious visual impairment. And you can imagine the disaster that can result in terms of road safety and their own lives. So far, we provided interventions to over 23,000 persons. Mission Roshni is an eye health intervention for children studying in government and government-aided schools, which are largely patronized by children from weaker socioeconomic backgrounds. We provided interventions for over 834,000 children, and that includes screening, refraction, spectacles, and even surgical services at no cost to them. We believe that all of this would have had a positive impact on the enrollment rates and educational attainment and learning. Mission 9 is addressing retinopathy of prematurity. We provided services for over 7,700 neonates so far, and more recently a pilot to address retinoblastoma through Mission Jeevan, where we are providing services for around 24 children. It's such a privilege to be able to be doing this. So our work has generated so much of evidence over the years, and we have therefore a number of publications on various subjects pertaining to issues such as quality of life, mental health, barriers to uptake of services, and also post-operative home care during cataract, among other subjects. We are able to influence policy and advocacy through our board and advisory functions, especially with the International Agency for the Prevention of Blindness, Vision 2020, the Right to Sight India, the Optometry Council of India, and more recently, the Strategic and Technical Advisory Group on the WHO Specs 2030 initiative. Our programs are geared to be sustainable because there's no point working if we do not have sustainability in mind. And how do we ensure that? Behavior change by addressing eye care knowledge and awareness among the community. That's important. The hospitals that we work with are highly credible and provide high quality care, which gives confidence to communities. We are able to build workforce from the community, the local community that includes health workers and allied ophthalmic personnel. The cross-subsidy approach, where revenue generated from paying patients is used to treat non-paying patients in the hospitals. Vision centers are sustained through revenue generated via affordable registration fee and the sale of spectacles at nominal prices. We leave the choice of the spectacle frame to children, And thereby that encourages children to wear them because they've chosen the frame for themselves. And more importantly, the high quality of services and respect which be able to work with the communities. Other than the Jenny Pomeroy Award, we were recently appreciated by the Fit for Life Award for reintegrating elders into an active and independent life by restoring vision and mobility. Population growth and aging, along with behavioral and lifestyle challenges and urbanization, will dramatically increase the number of people with eye conditions. Integrated people-centered eye care has the potential to accelerate action and meet these challenges. For this to be a reality, we would need to continue to position eye care as an integral part of universal health coverage. We would need to promote health systems research, widen partnerships, especially with the private sector, foster innovation, leverage technology, raise awareness, and engage and empower people in communities about eye care needs, and of course, continue to be seen and heard. As a visionary leader, Gandhiji said, strength does not come from the physical capacity alone, it comes from an indomitable will. It is because of the will of our founders, our team, our well-wishers, our donors, our partners that we've been able to do all this. Others wouldn't have done much. And it is this will that will take us forward. Thank you once again to Prevent Blindness and to Dr. Sandra Block for this opportunity.
Thank you so much for sharing all that Mission for Vision is doing. I have read about it multiple times, and every time I read, I'm just amazed that the diversity of programs and philosophies that you've done to create such a comprehensive program. And with that, just if anybody has any additional questions, we have 5 minutes for questions. Please put them in the chat box. I'm going to use a couple of the questions and ask you a little bit of insight. I think there's still some unknown as to how people get into the program. You talked about the cataract program, and you talked about the education and for individuals to become part of the system to solve the problem. But I don't think people understand that where it comes from, the screenings that are done on the ground to get access to the people who need it the most.
Yes, the screening, Sandy, is basically done by hospitals through 2 methodologies. One is the outreach screening camps, where a team from the hospital goes into the communities with prior notice, and with the help of local supporters and well-wishers organize screening camps. People are screened, and those that need services are taken back to the hospital, provided all the care that they need at no cost if they can't afford it, and of course at a cost if they can, and they are dropped back home. And of late, it's the vision centers that are more active because these centers are located closer to the communities, sometimes maybe 3 to 4 hours away from a hospital. And these facilities are partly supported by local healthcare workers who are trained in counseling and basic eye testing. And that gives confidence to the community. And once they see their neighbors being treated and coming home with great vision, the confidence increases.
Truly, the influence of your peers really has more of a significant effect than someone telling you what you're supposed to be doing. So I really love that idea. With that, that the concept of task shifting has come into how you deliver care, with the idea that you are now getting people who weren't trained in vision care to really reach out to the public and move individuals with the needs into the next step of addressing the vision impairment. Is that correct?
Yes, absolutely.
So with that, it's just amazing. Is it a reproducible program? I mean, you already have over 25 different sites. How can this be reproduced? So maybe even here in the United States, we could do it.
Yes, certainly it can be, because we started 25 years ago in one location in Coimbatore in South India with one organization. And now we work in so many different parts of the country in 22 states and various districts. So the idea is to start somewhere, learn from the experience, learn how to mitigate the challenges, build the momentum, build relationship with other areas and geographies, and grow. There is a lot of learning. There are challenges, but then you can with the right support. And we've been very fortunate to have the support of the government and our well-wishers, our partners, and especially donors who've been with us for so many years, who believe in us, and that gives us confidence to do more.
What do you think the biggest challenge you have in the future is to expand the access to care through your program?
The biggest challenge, Sandy, is human resources. Human resources are a serious constraint. Especially, over 70% of the population in India are in rural areas, and most of the brilliant optometrists, doctors, and other professionals are in the cities. And even in the rural areas, the southern part of the country is much better covered, the southern and the western part, but the northern, central, and east and northeast are challenged. And that's largely because we don't have adequate people with the right numbers and skills. So that is the biggest challenge. And that's why we're building the allied ophthalmic personnel category, because that's one group that's happy to work in these remote areas.
Since you've been around for 25 years as an organization, do you see some of these people who you've trained to be allied health professionals want to move up and learn more?
Yes, we have a number of them wanting to do optometry. Many of them have enrolled, and some of them have finished, and some are in the process of, uh, doing optometry as well.
That's actually
Some of
very
them
exciting.
also, exactly, yes. And some of them even want to do nursing. And of course, they're encouraged to do whatever they want to do as long as it's going to be beneficial to them in the long run.
Well, it is certainly amazing. You're addressing some of the issues that most of us have experienced as barriers and human resources, access to individuals, awareness, understanding. I'm truly impressed. Thank you so much for sharing all of the great work that Mission for Vision has done and is doing